When we talk about neck pain, we are actually talking about the pain you feel in your neck. This is a very common problem that many people face at some point in their lives. Just think about how much you use your neck every day. You turn your head to look at something, or you bend your neck to look down at your phone, and your neck holds the weight of your head all day long. This constant work can sometimes cause discomfort or pain. The pain can sometimes be sharp, like a sudden jab, or it can be a mild, constant ache that just won't go away. To understand this pain, it's important to first know about the body part where it happens. The neck spine is called the cervical spine in medical terms. This is a very important part of your body's structure. It's located right at the top of your spine, connecting your head to your upper back. This structure is made up of 7 small bones stacked one on top of the other. These bones are called vertebrae. Between these small bones are soft, cushion-like discs. These discs act as shock absorbers, preventing the bones from rubbing against each other during movement. The cervical spine is very flexible, allowing you to move your head in different directions. But this same flexibility also makes it more prone to injury and wear over time. There's another very important job for this part of your spine. It not only supports your head, which can weigh about 10 to 11 pounds, but it also protects the spinal cord. The spinal cord is a large bundle of nerves that goes from your brain down to your back. It's like a major highway for messages between your brain and the rest of your body. The nerves that come out of your spinal cord in your neck go to your shoulders, arms, and hands. These nerves control your movements and give you the ability to feel things like touch, temperature, and pressure in your upper limbs. So your neck isn't just a joint, it's a vital command center for your upper body. Sometimes the pain felt in the neck is just a simple muscle strain. Maybe you slept in a strange position, or you were hunched over a computer for too long. This type of pain usually gets better on its own with a little rest and gentle exercise. However, sometimes the pain can also be a sign of a more serious problem with the structure of your cervical spine. This problem could be related to the bones, discs, or nerves. It's important to pay attention to your body's signals and understand when the pain is just a temporary issue and when it's a sign that you should see a doctor to avoid a bigger problem. There can be many different reasons for neck pain. One of the most common causes is simply the aging process. As we get older, parts of our body naturally wear down, and the cervical spine is no exception. The discs between the vertebrae can lose water and become flattened and less flexible. This condition is called degenerative disc disease. Also, the body might try to create extra bone, called bone spurs, to strengthen the spine. These changes can narrow the spaces where nerves exit the spine, causing irritation and pain. This gradual wear and tear is a very common reason for neck discomfort in older adults. Another major cause of neck pain and potential nerve damage is injury. A sudden jolt, like in a car accident, can cause whiplash. Whiplash happens when your head snaps back and then forward very quickly, stretching the muscles and ligaments in your neck. A serious fall or sports injury can also damage the vertebrae or discs in the cervical spine. Sometimes a disc gets so damaged that its soft inner part pushes out. This is called a herniated disc. When this material presses on nearby nerves, it can cause severe pain and other symptoms that aren't just limited to the neck. Your daily habits and body posture also play a big role in the health of your neck. Many of us spend hours every day hunched over our phones, tablets, or computers. This position is often called text neck, and it puts extra strain on the neck muscles and vertebrae. Over time, this constant strain can lead to chronic pain and even contribute to faster disc degeneration. Similarly, jobs that involve repetitive head movements or keeping your head in one position for long periods, like painting a ceiling or long-distance driving, can cause muscle fatigue and strain, ultimately leading to persistent neck pain. Nerve damage in the cervical spine happens when nerves get pinched or squeezed. In medical terms, this is called cervical radiculopathy. Think of nerves like tiny electrical wires. If something pinches or puts pressure on that wire, the signal can't get through properly. This pressure in your neck can be from a herniated disc, a bone spur, or even swelling from arthritis. When a nerve in the cervical spine is compressed, it can't send clear messages to your arms and hands. This interruption in communication is what causes the specific and often bothersome symptoms of nerve damage, which are very different from a regular muscle ache. When a nerve in your neck gets pinched, The symptoms often show up in parts of your body far from your neck. The most common symptom is pain that can spread from your neck to your shoulder, arm, or even your fingers. This pain is often described as sharp, stabbing, or burning, rather than a dull ache. It can feel like an electric shock, shooting down your arm with certain movements, like turning your head or tilting it to one side. The exact path of the pain depends on which nerve is affected because each nerve controls a different part of your arm and hand. Besides pain, you might also have other strange feelings. Tingling, often described as pins and needles, is very common. This feeling can run down into your fingers or a part of your arm. It's similar to the feeling you get when your foot falls asleep. Another symptom is numbness, where you lose some or all feeling in a specific area. You might notice that your hand feels less sensitive to touch. Or it's hard to tell the difference between hot and cold water when you wash your hands. These changes in feeling are a clear sign that a nerve isn't sending or receiving messages correctly. Another important symptom to watch out for is muscle weakness. Since the nerves in your neck control the muscles in your arm and hand, pressure on them can make your muscles weak. You might find it hard to hold on to things tightly. For example, you might drop a coffee cup or have trouble opening a jar. You might also notice that it's difficult to lift your arm, or that some muscles in your arm or hand look smaller than before. This muscle weakness is a serious symptom, as it shows that the nerve is being significantly damaged, and it's a strong sign that you should see a doctor right away. It's really important to understand that these symptoms are your body's warning signals. While a stiff neck after a bad night's sleep might clear up in a day or two, symptoms like pain, tingling, numbness, or weakness are different. These symptoms suggest that a nerve is involved, and that's not something to ignore. Paying close attention to what you're feeling and where you're feeling it can help your doctor make an accurate diagnosis. Ignoring these symptoms could lead to permanent nerve damage and a longer, harder recovery. When you see a doctor for neck nerve problems, the first step is usually to try simple, non-invasive treatments. The goal is to relieve pressure on the nerves and reduce swelling. One of the most common recommendations is physical therapy. A physical therapist can teach you specific exercises and stretches designed to strengthen your neck muscles, improve your posture, and open up the spaces where nerves exit the spine. They might also use techniques like gentle traction, where your head is carefully pulled to reduce pressure on the discs and nerves. This method is often very effective and can provide lasting relief by fixing the basic mechanical problems. Doctors might also prescribe medicine to help control your symptoms. Over-the-counter pain relievers like ibuprofen or naproxen can help reduce both pain and swelling. If the pain is more severe, doctors might prescribe stronger medications like muscle relaxers or medicines specifically for nerve pain. In some cases, doctors might also suggest steroid injections. In this procedure, a strong anti-inflammatory medicine is injected directly around the affected nerve in the neck. This medicine can provide significant, though sometimes temporary, relief by reducing swelling and calming the irritated nerve. Changes in lifestyle are also an important part of the treatment plan. Your doctor will talk to you about the importance of sitting correctly, especially when you're working at a desk or using electronic devices. They might suggest making your workspace more ergonomic, like placing your computer monitor at eye level to avoid straining your neck. Simple changes, like taking breaks to stretch and move around, can make a big difference. Using a supportive neck pillow at night, one that keeps your neck in a neutral position, can help prevent pain and allow your neck structures to heal while you sleep. In very rare cases, if the pain is severe, weakness is getting worse, or traditional treatments haven't worked after several months, doctors might consider surgery. The goal of surgery is to physically remove whatever is putting pressure on the nerve. This might involve removing part of a herniated disc or trimming a bone spur. While surgery is always seen as a last resort, it can be an effective way to provide lasting relief when there's a clear structural problem that can't be fixed otherwise. Your doctor will fully explain the risks and benefits to help you make the best decision for your health and well-being.